Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, the producer of Public Health on Call. Thank you for joining us for Vaccine Week on the podcast. Today, Josh Sharfstein speaks to Carla Grossenbacher, an expert in employment law. Can employers mandate that their employees be vaccinated against COVID-19? Should they? Let's listen.
Carla Grossenbacher, thank you so much for joining me. Now, you're an employment lawyer. Could you explain a little bit about what your job entails?
Sure. I'm a partner at Seyfarth Shaw, and I'm the chair of the labor and employment practice in our Washington, D.C. office. So I counsel employers on compliance with employment laws, and I defend claims made against employers by employees. And recently in COVID times, I've been doing a lot of advising on matters like COVID testing and COVID vaccines for employees in the workplace because of my workplace privacy expertise.
So let's talk about the vaccine. What kinds of questions do employers bring to you about the COVID vaccine?
They want to know whether they have the legal right to mandate it. Then they want to know, should they mandate it? And probably most importantly, they want to know what every other employers are doing on the situation.
Well, I want to know those questions too. So let's go one at a time. Can employers mandate the vaccine?
The short answer is yes, if they follow certain rules.
Mm-hmm. And what are those rules about?
Well, the main restriction on an employer mandating a vaccine comes from the Americans with Disabilities Act, which says that employers can only mandate medical exams and disability-related inquiries in certain situations. For example, if it's job-related and consistent with business necessity, and that the employer would have to make certain accommodations for people with disability-related objections or religious objections to those exams and inquiries.
So assuming it's important for the business for people to be vaccinated, a business could mandate it as long as they had provisions for people in those categories.
Yes, although it's a bit of a high standard, you would have to show that an unvaccinated individual poses a direct threat in the workplace, which is why typically the only employers making that kind of argument for requiring a vaccine are hospitals, long-term care facilities, workplaces that have vulnerable populations in them.
Got it. They'd have the ability to do a strong mandate. But what about like a ice cream shop? Do they have the ability to mandate vaccination?
Yeah, they can mandate. The difference with the people who can make the job-related and consistent with business necessity argument are they can administer the vaccine themselves or bring someone on site to administer it. If you're an ice cream shop, you can still mandate it, but you have to let your employees go anywhere they want to get the vaccine from any healthcare provider they want, and you still have to make those accommodations for disability-related and religious objections.
This may seem like a simple question to an employment lawyer, but like, what is the basis for the ability for an employer to be able to require something like this of an employee?
Well, employers are free to set the terms and conditions of employment in their workplace. And the only backstop on that is if it's legally prohibited. So you can't discriminate against someone based on a protected classification. And when it comes to vaccines, you have to follow the rules under the Americans with Disabilities Act related to medical exams and disability-related inquiries and make accommodations.
Has the government commented at all on the ability of employers to mandate the COVID vaccine?
Yes. Well, given that the main legal restriction comes under the ADA and Title VII, the Equal Employment Opportunity Commission is the federal agency that enforces and interprets those federal employment laws. And they issued a guidance on December 18 stating the rules that we just talked about regarding when employers and under what circumstances employers can mandate vaccines.
Got it. So when employers call you, they're hearing from you, you can do it if you want to. But then their second question you said was, should they do it? How do you answer that question?
Well, I never tell them whether they should or shouldn't. I give them pros and cons. So to me, the two things that really are at the top of the list, setting aside that a mandate would come with potential legal claims by employees who don't want to get the vaccine, and you'd be tied up in those legal claims and processing accommodation requests. The two overarching things for me are, one, you're never going to have a 100% vaccinated workforce, right? Because you have to make those accommodations for disability-related and religious objections. And what I usually talk to employers about is, look, if you mandate the vaccine, how many more people do you think you're going to get vaccinated as opposed to if you just encourage it? Because people who have a real objection to taking it are going to pose a legal objection to getting it. So how many more people are you going to get vaccinated? And then it's that overused term of, is the juice worth the squeeze, right? With knowing you're going to get potential legal claims if you mandate it.
Got it. And what about the level of confidence people have in the vaccine? Do you think that is a consideration for employers? It's a relatively new vaccine. Do you think their confidence in mandating it might grow over time as there's more experience with the vaccine and people can see that the adverse effects are relatively mild and severe effects are extraordinarily rare?
I think that will have an effect because, A, it will be less controversial to mandate it once it's out of EUA status. And I think a lot of our clients have a real disinclination to mandate it when it's in EUA status, because they know that when the employees go for the vaccine, they get handed a patient fact sheet that basically says, you don't have to take this vaccine if you don't want to.
So let's pause for a second on that. It's really important. Right now, the status of these vaccines is that they've been authorized by the Food and Drug Administration. That's that EUA, but not licensed. And so this is a special authority that exists during an emergency like a pandemic. These vaccines are well on the path to licensure. All the studies were the same studies that would be done for licensure, and with a little bit more data submitted to the agency, I think it's pretty likely that they'll get licensed. So it sounds like what you're saying is, while they're in this authorized state, it's maybe making employers a little more reluctant compared to when they're fully licensed. Is that fair?
Yes, and they tend to focus on this language in the fact sheet that says, basically you don't have to take the vaccine unless you agree to take it. And then that's sort of inconsistent with them mandating it. And the only footnote I would add to what you just said is, we're getting all these reports on these new strains, and there's questions about whether these vaccines will be fully effective against those strains, which I think is also making employers say, great, so I mandate people to take this vaccine, only to find out 6 months from now, this vaccine isn't as effective as we thought, and they need to take a different vaccine. So it seems like the farther we go on, there's more questions sort of coming.
Do you think it would help employers for there to be federal recommendations or maybe public health recommendations with suggestions for what employers should be doing? Or do you think it's better for employers to be making these decisions one at a time?
Well, I think there is guidance, though. The CDC says that employers should encourage it. OSHA says employers can encourage it. So I think the bulk of the government guidance is you should encourage it. You can mandate it, but you should encourage it. Right. I think it'd be hard for the government to make an overarching position on that because workplaces are different, the hospital versus the ice cream shop.
Mm-hmm. But you could imagine a framework for helping businesses decide what the right path is. Maybe not now, but as there's more experience with the vaccine. I guess I'm getting to your final point, which is everyone wants to know what everyone else is doing. And I wonder whether that relates in part because people are nervous about taking a step. And I wonder whether there's something that, maybe it's not a federal recommendation. Maybe it's a National Academy of Sciences recommendation, or something that gives a framework to help companies think through this decision over time, whether you think that might be of use or whether people would say like, hey, wait a minute, you're infringing on my turf. I get to decide. I don't want to hear any pressure, maybe from a recommendation like that.
I think the main issue would be once that recommendation is out there, X and such employers should mandate it. If that employer doesn't want to, there is then a potential liability risk in not doing it. So once that kind of recommendation is out there, it changes the landscape of right now, no one's telling me I have to, no one's telling me I should mandate it. So, because one of the questions we get is, well, if I don't mandate it and someone gets COVID, are they going to be able to come after me for not mandating the vaccine? And right now, there's no requirement that they mandate it. And of course, there'd be a million reasons why an employee couldn't prove that they got it in the workplace as opposed to anywhere else. But that is a question that weighs on employers' minds.
Got it. I didn't think about that. So you have on the one hand, the concern about mandating it, the concern about not mandating it, and companies trying to figure it out, even if their business is ice cream and not public health.
Right. And even that ice cream shop owner has employees who interact with the public when they're scooping ice cream, right? And I say this having worked at a Baskin-Robbins in my youth. But those are the types of businesses that are thinking, we want to be able to say, hey, everyone in our ice cream shop has been vaccinated. Come here to get your ice cream because it's the safest place to get ice cream in the city, right?
Interesting. So it sounds like there'll be some settling out of this over time. It's a moment when there's a lot of thought about it. People are wondering, but as the vaccines maybe become licensed and people become more comfortable with it and kind of norms get set, we might see more activity in this area.
Right. And certainly right now, a lot of employers are just talking about it because right now there is no ability to mandate it because their employees can't go out and get the vaccine because they're not proper phase.
Right. Exactly. So let me ask you maybe an extension of this question. Have employers asked you about their ability to require that their customers be vaccinated?
Yes, we get questions about just in general, can they require third parties to be vaccinated? And the irony is you have more latitude there because the ADA and Title VII are employment statutes, right? So they only apply to your dealings with your employees. So you don't have to abide by those restrictions in dealing with your customers. So it often comes down to, well, is this private property? Can I say who comes on my private property? Yes, I can.
So that's not that hard a legal question to answer compared to the employment one.
Right.
But it may have business ramifications one way or the other.
Yeah.
Interesting. All right. Anything else you think people should generally know about this emerging area of COVID law and practice?
Well, the only other question that comes up with some frequency is the issue of providing incentives to get the vaccine. And it's kind of a complicated legal analysis because you've got the EEOC's guidance on under what circumstances you can require a vaccine. And then they recently proposed a rule governing wellness programs. And technically, if you provide an incentive that requires you to get a medical exam or submit to a disability-related inquiry, you have to follow these wellness rules. And the proposed rule says in a voluntary wellness program, you can only offer a de minimis incentive. So you hear in the news of various employers offering incentives, and you have to kind of go through this analysis of, am I offering something too big? Is this in fact a wellness program? I think employers are being very cautious in terms of what they offer to incentivize.
Got it. And that will apply, it looks like, to the COVID vaccine too.
The EEOC has yet to state what impact its proposed wellness rule has on the vaccine rollout because it's a proposed rule and they can't really talk about impact until it's finalized. So it's a little unclear.
Got it. Well, we'll stay tuned. Maybe we'll check back in with you. Thank you so much for taking time to talk with me today. It's really interesting.
Absolutely. My pleasure. Thanks for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Hagedor, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.